In Rose LeMay. She is the CEO of Indigenous Reconciliation Group. Rose, good morning and thank you for your time. It's the fifth year of National Day for Truth and Reconciliation and 10 years since the Commission released 94 calls to action. How far have we come, according to you?
I think we've come farther than we would like to actually admit. I was looking at that poll that you were describing, and I was thinking 20 years ago there was a poll that was run out of CBC and asked Canadians of non-Indigenous descent if they would be comfortable if one of their kids married an Indigenous person. And the polls was all the way to the other side in terms of more than half of Canadians would be very uncomfortable if that were to happen. I think we've come a long way in 20 years. Have we got some more room to grow? Absolutely. But it's important to recognize that in the past 20 years, we've done an enormous amount of education and awareness building, and we've come to this point fairly quickly to even normalize a National Day of Truth and Reconciliation. We have made progress, and perhaps now we can see the progress we still need to make.
The recommendations, as I was saying, covers huge amounts of areas: child welfare, education, language protection, justice, healthcare. Talk to us about the challenges in healthcare, a sector where you have been working for a very long time.
Healthcare is a bit, unfortunately, late to the journey of reconciliation. Since the loss of Joyce Echaquan and Joyce's principal, there hasn't been nearly as much progress as I expected. Have hospital boards, have hospital associations, has hospital CEO associations taken this as a priority and urgency? Not to the extent that they really should. This is a major patient safety issue for Indigenous peoples. The amount of racism that Indigenous peoples continue to face in mainstream hospitals in big cities is extraordinary. And we would not expect that for any one of our neighbors. We would expect better. So I'm looking to healthcare associations to follow the lead of the Canadian Federation of Nurses Unions, to follow the lead of the Canadian Medical Association, who both apologized for racism past and current and committed to do better. That's the way forward for healthcare. If they do not make some changes quickly, they will also be in a place where they're going to need to apologize. There's enough information out there. They know what they need to do.
Rose LeMay, appreciate your time. Thank you.
Thank you.